Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Transesophageal Echocardiogram. Introduction. A transesophageal echocardiogram, also called a T, helps a doctor see images of the heart. These images can help the doctor find out if the heart has normal structures and works properly. Your doctor may request that you have a transesophageal echocardiogram. This patient education program explains why a transesophageal echocardiogram is needed and what you can expect before, during, and after the procedure. The heart. The heart is the most important muscle in the body. Its main function is to pump blood to the lungs and to the rest of the body. This section reviews basic information about the anatomy of the heart. The heart has two sides, the left side and the right side. Each side is divided into two sections. These sections are called chambers. These two chambers are called the atrium and the ventricle. The blood from the body comes through the big veins into the right atrium of the heart. From the right atrium, the blood is pumped to the right ventricle. The blood then gets pumped to the pulmonary artery and into the lungs. In the lungs, the blood gets loaded with oxygen and carbon dioxide is released. From the lungs, the blood goes to the left atrium, then to the left ventricle. From the left ventricle, the blood is pumped to the rest of the body through the aorta. The aorta is the biggest blood vessel in the body. Valves separate each atrium from the ventricles and the ventricles from the pulmonary artery and aorta. These valves allow the blood to only go in one direction. A membrane called the pericardium surrounds the heart. This smooth covering allows the heart to beat smoothly. Since the heart is living tissue, it needs blood like the rest of the body. The heart pumps blood through many blood vessels that go directly to the heart muscle. The heart is very close to the esophagus, which is also called the feeding tube. During a transesophageal echocardiogram, the doctor inserts a special tube into the esophagus to take pictures of the heart. The throat separates into two separate tubes. Air goes through a tube in the front called the trachea. Food and liquid go through a tube in the back called the esophagus. The vocal cords are located in an area known as the larynx, which is slightly above the trachea. During an esophageal echo, the tube inserted by your doctor will go through the mouth and then into the esophagus. When is a T needed? A T lets your doctor see animated pictures of the heart while it is beating. It can also show blood flow inside the heart. Your doctor may recommend a T if he or she thinks your heart may have problems. Your doctor can also use an echocardiogram to decide if you need treatment or to see how well a treatment is working. Many heart defects can be found with a T, including problems with the heart chambers, abnormal connections between the heart and major blood vessels, and complex heart defects that are present at birth. A T shows how your heart valves move as your heart beats. This can help your doctor find how the heart chambers and valves are working. A T can also help your doctor find out how blood is flowing inside your heart. A T can let your doctor see if there is any fluid gathering in the membrane that surrounds the heart. During a T, your doctor can figure out if all of the parts of the heart are working equally to make your heart pump. Parts that move weakly may have been damaged during a heart attack or may not be getting enough oxygen. A T lets your doctor see how strong the heart muscle is after a heart attack. A T can help your doctor check your heart's pumping strength. If your heart isn't pumping enough blood to meet your body's needs, heart failure may be a concern. A T may be used to see how a treatment is working or how helpful a surgical procedure was. In a T, the transducer is placed inside the esophagus of the patient. If a patient is obese or has certain lung problems, a transthoracic echocardiogram may not be able to create good enough pictures of the heart. In other patients, the ribs in the chest may be very close together and make it difficult for the waves of a standard echo to reach the heart. In some people, it is not possible to get a good view of the back of the heart from a transthoracic echo. If your doctor needs to view the mitral and aortic valves, a regular echocardiogram may not give clear pictures because of where the valves are located. If your doctor is not able to see the heart clearly with a regular echocardiogram, a transducer can be put in the esophagus just behind the heart. This gives much clearer pictures. This is called a transesophageal echocardiogram, or T. How T works. To create an image of the heart, sound waves are created by a device known as a transducer. The transducer is placed down the patient's throat into the esophagus, which is next to the heart. As the waves touch the heart, their echoes bounce back to the device. The speed and intensity of the echo carries information about the heart tissue. This information is made into an image. Your doctor can read the images to learn about the muscles, valves, and other structures and functions of the heart. The echo produces animated pictures of the heart that show the heart working. It can also show blood flow inside the heart.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative tests. Your doctor can learn a lot about your heart by taking your pulse, measuring your blood pressure, and listening to your heartbeat. A tracing of the heart, known as an EKG, can also be very helpful. Echocardiogram is sometimes called echo for short. In a standard echo, the transducer is placed on the chest in the area that lies directly over the heart. A standard echocardiogram is also known as a transthoracic echo. Before the test. Do not drink or eat anything for 6 hours before the test. This helps decrease the risk of vomiting during the procedure. Check with your physician to see which of your regular medications you can still take with a sip of water. Tell your doctor if you have any disease of the esophagus, the tube that connects the mouth to the stomach. Make sure to have somebody drive you home and stay with you after the procedure. The sedation will make it unsafe for you to drive. You will be able to drive the day after the procedure. During the test, you will be asked to remove the clothing on your upper body and lie down on the exam table. The technologist will attach electrodes to your chest, wrists, and ankles. These will be used to record an EKG while the echo is taken. Your breathing, heart rate, oxygen level, and blood pressures will also be monitored. You will be given a sedative through an IV to relax you. You will be given a solution to gargle that will numb your throat. A numbing medication may also be sprayed at the back of your throat to relieve pain. You may feel drowsy. This is normal. You will be asked to lie on your left side on an exam table. The doctor will insert a thin, lubricated tube into your mouth and down your throat into your esophagus. This may be uncomfortable. This is normal. The transducer is located at the end of the tube. You will still be able to breathe normally. You may be asked to swallow to help the tube move down easier. Thanks to the numbing medication and slight sedation, this procedure is not painful. Once the transducer is in place, the doctor will start to collect pictures of the heart and record them on a special computer. You will not feel the tube during this part of the test. You may be sedated and not fully awake at this time. This is normal. Tell your healthcare provider if you feel uncomfortable. Once your doctor is done, the tube and the transducer will be taken out. You will then wait to recover from the sedation. The whole procedure from the beginning to the time you get to go home can take about 2 hours. This can be different from patient to patient. Your doctor may discuss the results with you right away or send them to your family doctor. Ask your doctor when the results will be ready. After the echo. The T is an outpatient procedure, which means you will go home after the test. You can resume regular activities the day after a T. Make sure to have somebody drive you home. You will not be able to drive for about 12 hours. Do not eat or drink anything for at least 2 hours after the procedure. During that time, your throat may still be numb and you may not be able to swallow well. If you eat immediately after the procedure, some of the food or drink you take in may end up in the lungs and cause serious complications. 2 hours after the end of the procedure, you may start drinking a cool liquid. If you have no problems drinking cool liquids, eat and drink as you normally would. You may feel a temporary soreness or numbness in your throat after the procedure. This is normal and may last a few days in some people. Throat lozenges may be used after 2 hours to get rid of throat soreness. For the first 24 hours after the procedure, do not eat or drink anything that is hot or cold. Make sure to call your physician if you have continued pain, fever, bleeding, difficulty eating, difficulty breathing. Risks and complications. T is a very safe procedure. Risks and complications are very rare but possible. Complications include bleeding and infection. Injury to the teeth, mouth, throat, or the esophagus is possible but rare. If the esophagus is punctured, emergency surgery may be needed to fix the injury.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. A transesophageal echocardiogram can be very helpful. It can show your doctor the structure and function of your heart. A transesophageal echocardiogram is painless and very safe. Thanks to echo technology, many diseases of the heart can now be diagnosed and treated. Thank you for using Explain.